Good afternoon, everyone. I'm Scott Allen. I'm the Chief Executive Officer for the Family Medicine Education Consortium. And I'm happy to welcome you to our webinar today, Connecting with the Community, Parks, Recreation, and Fitness. So thanks for joining us. We're looking forward to an exciting discussion of social determinants of health and physical activity and how the National Recreation and Parks Association and family medicine residency programs and health systems like Meritus Health can work together. So with that, I'm gonna share my screen and do a little bit of an intro. So again, thank you for joining us. I want to tell you just a little bit about the FMEC. For those who don't know, we are a catalyst, a convener, and an incubator that serves the Northeastern United States. We work in 14 states and DC. So it's basically Ohio East and the Virginias North. And in that region, we have about 60 medical school departments of family medicine and about 195 family medicine residency programs. We're very focused on promoting family medicine and primary care to medical students. We bring a lot of medical students to our annual meeting to learn about family medicine and hopefully move into a family medicine residency program. We support residents as they transition out of training and into their careers. We strengthen academic family medicine by helping faculty connect with each other and learn from each other. And then we create and sustain quality improvement activities. We've done things around oral health, integrative health, low birth weight, and other topics like that. And really, we're here to promote family medicine and promote primary care. So why are we doing this series of webinars? Well, the social determinants of health are critically important, and their presence in medical training and residency training is growing every day. Even in communities where quality healthcare is easily accessible, the majority of health inequity and inequality can be ascribed to other influences, such as environment, social and economic factors, and learned behaviors. So medical education and residency training programs need to focus on the roles that the social determinants of health play in wellness, not only to keep families healthy, but also to meet their training requirements. And family physicians are not alone in striving toward health equity. Nationally and in every community, there are a lot of other diverse groups and advocates and non-medical providers who are working to address critical issues such as housing, employment, food insecurity, physical activity, and more. So each community is different, and the constellations of healthcare providers in those communities and social service providers and others who are tackling social determinants of health are unique. But understanding the national perspective, which we will get from our speaker today, and also what can happen at the community level is critically important to help family physicians and residents engage with their partners, no matter where they train or practice. As you can see, the family medicine literature has had quite a bit on social determinants of health in recent years. And also, it is a training requirement that family medicine residency programs address the social determinants of health. For the Accreditation Council for Graduate Medical Education, a common program requirement across all specialties is that residents must demonstrate an awareness of and responsiveness to the larger context and system of healthcare, including the social determinants of health, as well as the ability to call effectively on other resources to provide optimal care, other resources such as park and recreation facilities. The ACGME family medicine program requirements are under revision right now, but the new version, which will come out and be effective next year, includes similar calls to action around social determinants of health, such as the quotes that are up on your screen. So the Family Medicine Education Consortium has set up this series. We did one webinar last week around food insecurity. We're doing today's webinar, and we have another next week around digital divide and digital access to help family medicine providers, physicians, faculty, residents, and medical students interested in family medicine to identify the challenges that are present in communities to serving their families, to get new ideas for how to counsel patients and direct them to community resources, to work more closely with community groups like park and recreation facilities, perhaps by bringing them on to advisory councils or having them come speak to the residents. And then to integrate new concepts into how they teach. We have a speaker today from a family medicine residency program, and we have, as I mentioned, 195 in our region, each of which is doing exciting and unique things around social determinants of health. So with that, I want to do a quick poll. And I want to ask you, how often do you think healthcare providers recommend physical activity in the local parks and recreation facilities as part of their wellness visits? So I'm launching the poll now. Love to see how many people think that they're recommending visits all the time or at most visits, sometimes, or not enough. Give you just another few seconds so everyone can respond. So I'm going to go ahead and end the poll, even though not everybody's had a chance to respond and share the results. Looks like we have a lot of work to do. Sometimes, and most, about 3/4 say not enough. So I think hopefully we'll get some ideas from this webinar about how to do that more effectively, and how to do it so that patients can take advantage of the great park and recreation facilities in their area. So with that, I want to go ahead and introduce our two speakers for today. First, we're excited to be joined by Allison Coleman, who's the Director of Health at the National Recreation and Park Association. Very honored that she was able to come talk to us, a regional group, from her national perspective. NRPA is the leading not-for-profit organization dedicated to building strong, healthy, and resilient communities through the power of parks and recreation. For over a decade, Allison has led the development and implementation of evidence-based public health initiatives and built cross-sector collaborations to advance innovative, community-driven systems change strategies. So lots of work going on between the national organization and healthcare, and we're going to hear about some of it from Allison. Following Allison, we're going to hear from Dr. Doug Spots, who oversees Meritus Medical Group operations and clinical quality and safety leadership for the 150 providers in the Meritus practices, both specialty and primary care. Doug has over 25 years of clinical and operational experience, and he leads the Meritus Health and Community bold goal of losing 1 million community pounds by 2030. He also helped found the Meritus Family Medicine Residency Program in 2019 with his team. He's board certified in family medicine, and he received his medical degree from the Pennsylvania State University College of Medicine. So with that, I am going to turn it over to Allison, who is going to tell us a little bit about parks.
Wonderful. Thanks so much, Scott. I'll just go ahead and get my slides going here, and give me a thumbs up if you've got that and can see those slides, or just let me know if you can't, I suppose. Perfect. Well, good afternoon, everybody, or good evening, I suppose, depending on where you're joining us from. It's great to be here. I'm Allison Coleman, as Scott said, she, her pronouns, and I'm the Director of Health with the National Recreation and Park Association. And I'm really looking forward to this conversation today. I'm planning to spend just a little bit of time talking about our organization, really the work that NRPA does, and how we support local park and recreation professionals across the country. I'm going to share some data on the national sort of scope of the park and recreation field, and highlight the impact that parks and recreation have on health and well-being. And then I'm going to talk about our strategic vision, really in terms of supporting park and recreation professionals to serve as community wellness hubs with health equity at the center of that vision, and share some examples of what local park and recreation agencies have been doing alongside healthcare partners. So really, really excited to be here today. We don't have a ton of time, so I want to encourage folks to reach out to me. I'd be happy to have conversations offline about anything that's on your mind related to Parks and Rec. Before we jump in, though, I thought it would be kind of fun to kind of go off of that poll a little bit and ask you all how Parks and Recreation have influenced your own personal health and well-being. So feel free to take advantage of that chat. And just let me know, is there a memory or is there something that you want to share with the group in terms of how Parks and Recreation have had a positive impact on your own personal health and well-being or on your community's health and well-being? Always love to kickstart the conversation with hearing from the audience about how you're benefiting from your local Parks and Recreation. And for time's sake, I'll probably just keep moving through, but I just want folks to think about, as you think about your own health and well-being, what role Parks and Recreation is really playing in that for you. So feel free to throw those in the chat. We'll keep moving for today's purposes, because I know we've got a small group here. So NRPA, We are the National Recreation and Park Association, as we've said, and we're the national nonprofit organization that represents all local park and recreation systems nationwide. So think of your city, county, regional park and recreation system. Those are our members. We have over 60,000 members, and most of those folks are park and recreation professionals, people who are on the ground working in their communities each and every day to really make the places where people live, learn, work, and play healthier and happier. We're based in Ashburn, Virginia, although we are a fully remote organization, made that decision during the pandemic. We still have our headquarters though, so if you're ever in the Loudoun County area, let me know, I'd be happy to meet up. And our vision at NRPA is that we really seek a future where the full power of parks and recreation is widely recognized for creating a better life for everyone by building strong, healthy, and resilient communities. And that is what we are committed to and the work that we strive to do each and every day. And within that vision, we have 3 core pillars. These are really the areas where we feel parks and recreation can have some of the greatest impacts on their communities: health and wellness, equity, and conservation. And I want to name, starting off this presentation, that equity is really at the center of everything that we do at NRPA, because we are striving for a future where everyone has fair and just access to quality parks and recreation. And we know that that is not the reality today. Within our health and wellness work, I'm going to spend the bulk of my conversation talking about that, but we're really focused on leveraging the power of parks and recreation to advance community health and well-being. And then within our conservation pillar, really creating a nation of resilient and climate-ready parks to fight the impacts of climate change and really build the next generation of environmental stewards while protecting our natural habitats and ecosystems. So those are the 3 pillars. You'll see those lifted up in pretty much all of our communications. I wanted to share some data points about the sort of national scope of the park and recreation field. And so you'll see on your screen a couple of key figures and metrics, and just wanting folks to sort of understand, the depth and breadth of what parks and recreation do. So there are 10,000 local park and recreation agencies nationwide. About 2,000 of those are in rural communities, populations of under 50,000 or so, and the other 8,000 are these larger, urban and metro center communities. There are over 165,000 park and recreation professionals working in 105,000 close to home parks, green spaces, trails, recreational facilities, and amenities. 8 in 10 park and recreation agencies provide access to health and wellness education as part of their portfolio of programs and services. And the typical agency is reaching nearly 300,000 contacts per year. That's essentially, how many people are engaged in park and recreation programs, events, offerings. That could be one person engaging in multiple, though. It's the best way we have to track that data at this moment. But the reach is pretty extensive of this field. And agencies manage everything from summer camp programs, after school programs, to farmers markets and community gardens, to meal programs for youth and older adults who are struggling with food security, to, of course, the facility maintenance side of things, your parks, your play spaces, your trails, historical sites, major sports facilities. So the field is very unique and has a lot of responsibilities. And to check out and learn more about the field, we publish a performance review report every year that's accessible on our website. And essentially it provides more detail on agency budget, operations, programs, infrastructure by sort of the size and scope of that agency. So I definitely recommend checking that out to see more about your local park and rec agency. And so as we talked about, one thing that we definitely want to name here is that parks and recreation, absolutely essential to the overall health and well-being of our communities. And they play a key role in really shaping the conditions where people live, learn, work, and play, those social determinants of health, which is why we're all here today. We know that, access to these factors, good paying jobs, healthy food, safe environments, housing, education. Those are the things that have the greatest influence on our overall health and socioeconomic outcomes. And Parks and Recreation play a key role in that in terms, of creating those healthy environments and spaces, but also in terms of connecting people to the needed social resources and social capital across communities. So we do know there's a substantial amount of research and data that's out there that really demonstrates that people who live near parks and utilize their parks benefit physically and mentally from these places, spaces, and programs. Parks and Recreation has been proven to have a positive influence on physical activity. People who use parks and open spaces are 3 times more likely to achieve the recommended levels of physical activity than non-users. And children who are lacking access to parks are more likely to be physically inactive, have excessive screen time, inadequate sleep, and more likely to be overweight or obese. Parks and Recreation also have a significant impact on our mental health. Green space is connected to improved physical health, but also connected to improved mental health, including reduction in depression, anxiety, and other mental health conditions, on top of some of those physical health benefits that reduce the risk of chronic disease, like lowering blood pressure, decreasing stress, lowering heart rate. And then, of course, being physically active has a positive influence on healthcare cost savings. So Parks and Recreation provide tremendous benefits to communities and are a key part of our public health systems. And in fact, the public really agrees. 93% of all US adults believe that Parks and Recreation are essential to their mental and physical health and well-being. And all of those data points that I just referenced are available on our website. We have a set of kind of Parks and Recreation is essential key statements. And so all of those statements are backed up by research that is out there, and you can take a look at that. But despite these benefits, significant inequities persist. And so we know that 100 million people, or almost 30% of the population, do not have access to the benefits that Parks and Recreation provides. And they do not live within a park, within a 10-minute walk of a park close to their home. On top of that, parks and public spaces don't always feel welcoming, inclusive, safe, or culturally relevant for the community being served. And so that is why equity is at the center of our work at NRPA. We recognize that those gaps exist. We believe that everyone deserves access to the health, social, economic, and environmental benefits of Parks and Recreation, but we know that that is not the current state. And so how are we addressing these gaps? Well, as we know, Parks and Rec, key to a fully integrated public health system. And so our vision is really focused on advancing community health and well-being by helping our professionals to serve as stewards of what we are calling community wellness hubs. And community wellness hubs build on the existing strengths, foundations, and assets of local park and recreation agencies and their community partners, including healthcare partners. Those are some of the largest partners that park and recreation professionals indicate they have. It's about 60% of agencies indicate that they have some sort of partnership with a local healthcare provider or healthcare system. And we want to see that continue to grow. But within this vision of community wellness hubs, which we define as trusted gathering places that connect every member of the community to essential programs, services, and spaces that advance health equity, improve health outcomes, and enhance quality of life, we are focused on addressing the root causes of health inequities and promoting health across multiple levels of intervention and holistically. And so I'll talk a little bit more about that in terms of the guiding principles that are really at the core of our community wellness hub strategy. And so those 4 guiding principles are, as I just said, that we want to be promoting a holistic approach. We are working with our professionals to make sure that they are applying that whole person, whole community lens to this work, to equally value other dimensions of wellness in addition to physical health, because we know that being healthy and well is more than just being free of disease. The second core guiding principle is that, as we've said already, we want to be centering health equity, and we're doing that by helping our professionals to advance systems change approaches to address those root causes and address barriers to health. And then the last two are changing the narrative. And so part of the reason why I'm here today, we want to engage more people in this movement, especially key stakeholders and decision makers and people who have influence and power over folks' lives and can help them make healthy decisions. And so we want other folks to understand the benefits that local park and recreation systems can provide from a health and wellness perspective, and that they are a key part of our public health ecosystem. And lastly, we're focused on really supporting the professionals. So we provide training, technical assistance, learning opportunities, and other professional development opportunities to ensure that our professionals have the skills and competencies needed today, but are also preparing for the emerging public health threats that they'll be confronting in the future. I'm going to talk more specifically about these first two guiding principles and share some examples of what that looks like in practice. So in terms of promoting a holistic approach, it's really critical to address today's public health challenges, everything from chronic disease to food security, substance use disorder, people experiencing homelessness, community violence, and social isolation. Park and recreation professionals really have to focus on these solutions that value health equally across a number of different dimensions of well-being, while also centering health equity and addressing those root causes. So NRPA is going to be releasing our new Community Wellness Hub Toolkit the second week of June, actually, so be on the lookout for that. But in that toolkit, we have essentially released a framework for how park and recreation professionals can serve as stewards of these community wellness hubs. Again, making sure that we are defining health and wellness as really an optimal state of physical, mental, social well-being compared to those historical definitions of being free of disease, and really focused on sort of physical health. So this graphic that you see on the screen here really illustrates our focus on these 7 interdependent and interconnected dimensions of well-being: cultural, economic, emotional, environmental, intellectual, physical, and social. And so within this Wellness Hub Toolkit, we are laying out strategies and approaches for our professionals in partnership with community-based organizations and other community stakeholders to offer programs, services, and spaces across each of these dimensions in these trusted gathering places, in local parks, in recreation centers, out in the community. A lot of park and recreation agencies offer mobile programs that really meet community members where they are. And so, for example, looking at the economic well-being focus, a park and recreation agency can ensure that they're serving as a community wellness hub by, providing access to workforce development, career development, mentoring opportunities for youth and for young adults, access to good paying jobs for community members, and connections to other social services and resources like SNAP benefit outreach, connecting families to housing, making connections to other social service providers. So the model doesn't call for park and recreation professionals to be the expert on everything or to be the implementers themselves. Rather, it calls for bringing folks to the table to bring these services and locate them in these trusted gathering places that can reach community members. And again, that is primarily because we know the inequities that do exist, primarily caused by unfair systems, including power structures, decision-making practices, policies, norms, relationships, environments that have really created barriers to health, primarily for Black, Indigenous, people of color, low-income communities, rural communities, and other historically disenfranchised populations. So health equity is at the center of that vision, making sure that these community wellness hubs are being established in communities that have experienced disinvestment and are under-resourced. And to do that, We have another great tool that I wanted to share, which is our Elevating Health Equity through Parks and Recreation Health Equity Framework, essentially. We released this back in 2021. And essentially, it's a toolkit that's really focused on helping park and recreation professionals, sorry about that, helping park and recreation professionals to really apply an equity lens as they are looking at their programs, their services, their operations. There are 4 main components in the toolkit. There's a self-assessment tool, an agency assessment tool, an action planning tool, and a health equity integration tool. And while it's designed for park and recreation professionals, this can really be utilized by any organization. And essentially, it helps you ask really key questions to better center equity within your work, and then develop an action plan for how you'll do that through practice, policy, and other systems change approaches. So that's available on our website as well. And we have been providing training and technical assistance to cohorts of grantees as they've navigated their way through this framework. And we're really excited that we're starting to see evidence of health equity approaches being implemented and systems change beginning to occur. When we talk about systems change within this Community Wellness Hub model, we are primarily focused on these 3 areas of systems change. So looking at policy change, environmental change, and behavior change. And those are really the areas where we feel our professionals have the most leverage and momentum to create these long-term sustainable solutions. And so really focused on changing rules and regulations at an organizational or site-specific or even program-specific level, focused on changes to the physical and the social environment to make sure that people have access to health and wellness opportunities, and focused on changing attitudes, self-efficacy, and norms, really addressing behavior change. And so that's where you'll see in our Community Wellness Hub Toolkit, again, coming out in June, that we're focused across each of those dimensions. We provide examples of how a park and recreation agency could advance these systems change strategies. One example, if we take a look at mental health, and we're providing coaching and training and TA around policy. We want to help our agencies enact an agency-wide policy that ensures mental health programs are being prioritized in under-resourced communities and communities with disproportionate rates of mental health conditions. So that's one example of some of the sample strategies we feature in this toolkit. But we know, of course, that partnerships are really critical to advancing this vision of community wellness hubs and to advancing overall health and well-being across communities. We know there's more power as a group than working alone, and to achieve transformational change, which is what this vision is, that really requires systems thinking, that requires bringing different stakeholders and different resources and assets and perspectives and experiences to the table to create those solutions. And that is what is going to result in change, right? Collaboration leverages those resources to fuel progress and impacts. And so, as I said earlier, this model really calls for partnerships, and healthcare providers and physicians are certainly one of those core groups we're looking to increase partners with across the field. And so I wanted to share just a few examples of what this looks like in practice, and then I'll wrap it up on my end. But at the macro level, over the past 2 years, we funded 15 park and recreation agencies and community partners to implement community wellness hubs. And these focus specifically on increasing access to healthy food, nutrition education, and centering health equity and beginning to advance health equity approaches and strategies. So each agency was provided with training, technical assistance, funding, peer networking opportunities facilitated through a community of practice. And we saw some incredible results from that. So again, the aggregate of the impacts is that 18 million healthy meals were served to youth and adults in these communities through primarily the federal nutrition programs, but expanding those efforts to meet more people where they were, and also establishing new food access points. 228 new food access points were created. Those were things like food distribution centers, community gardens, farmers markets, creating those environmental changes. 31,000 households were provided with SNAP outreach and SNAP enrollment support. So linking people to those social services and those sustainable benefit programs that are federally funded, and 320 plus new partnerships were created. We also saw some incredible outcomes related to nutrition education. 48% of people who participated in these evidence-based nutrition education programs increased their fruit and vegetable consumption, and almost 30% are preparing more meals at home. And then one thing that's super exciting here is that adults who took part in these programs, we did pre and post surveys, and adults ranked themselves higher in every quality of life indicator after completing the nutrition education activities and programs. So that speaks to, again, the interconnectedness of these different focus areas and these dimensions of wellness, but how they can have a greater impact on overall health and well-being. And if we look at the community level, and obviously Doug is going to speak to this a little bit more, but I wanted to share one example. There's some incredible work happening across the country. And I wanted to share this one because it is a specific partnership between a healthcare system and a park and recreation agency. So this is the Fraser neighborhood in South Dallas. It is a community that really suffers from a lot of challenges. Lacks access to services that are essential to healthy living, like healthcare, grocery stores with healthy food options, exercise programs. 50% of people living in this community are living below the poverty line. 34% of residents are uninsured, 40% of adults been incarcerated, high rates of youth dropping out of high school. This is also a community that has some of the highest rates of chronic disease across the city of Dallas, diabetes, heart disease, cancer, stroke, and residents in the surrounding zip codes in this neighborhood were 3 times more likely to die of a chronic disease than somewhere else in Dallas. And so a neighborhood, a community, again, that's facing a lot of challenges related to health and wellness. The solution that the city and their partners at Baylor Scott and White Health created was to actually establish a wellness center in this community that is located at a recreation center owned and managed by the city of Dallas. And what they did was they brought in a health clinic to this setting along with healthcare professionals, including nurse practitioners and care coordinators. They brought in evidence-based health programming, established a farm stand, cooking classes, all of these amazing health and wellness programs and services. And the impact has been incredible. 5,500 people have been served. So 21% reduction in emergency department utilization because many residents didn't have access to primary care. They were relying on the emergency department for services that they would normally access through a primary care physician. Almost a 40% reduction in inpatient hospitalizations. And there's some really exciting work happening with electronic health record referrals to basically at the point of care, referring patients directly into some of these evidence-based health programs. We helped to support a project that was focused on the Walk with Ease program related to arthritis management. But more importantly, because of the success of this, the city now has plans to convert 6 additional recreation centers into wellness centers in those areas of highest need. So this is the power of community wellness hubs, and this is what we're looking to scale nationwide. And of course, we need partners to do that, and we need to be facilitating conversations between our local parks and rec and folks like you. So I'll just leave it at that. Consider partnering with your local park and recreation agency. They wear a lot of hats, but they do play a critical role in communities as trusted leaders, and they're really champions for change. So if you're looking to get in touch with your local park and recreation department, feel free to reach out to me. Would love to try to make that connection if possible. And again, happy to answer any questions you have offline or later today. So with that, I am going to stop sharing and turn it on over to Doug. I'll speak more about the community level work.
Again, great to be with you. I heard in that presentation partnerships, health equity, transformational change. I love the guiding principles of NRPA's Community Wellness Hub strategy, because it sounds like it's a playbook right out of the hands of a family physician, whether we're in private practice, direct primary care practice, an academic setting, employed practice model as a federally qualified community health center, and just absolutely in alignment with sort of, I'll say, putting population health into action for many of the same goals. So let me tell you a little bit about moving from the Fraser neighborhood in South Dallas to Hagerstown, Maryland. The unique area that we're in here in Washington County, Maryland, is bordered by southern Pennsylvania, the eastern panhandle of West Virginia, a little bit of northern Virginia, not too far away from Allison, and of course, Maryland. Right at that intersection of routes 81 and 70. And Washington County has great city and county parks, as well as some national parks. So we have the C&O Canal, which goes from Georgetown, of course, all the way out to Cumberland, Maryland, and goes along the beautiful Potomac and is the southern border of this county. We also have the Antietam Battlefield. And then, like I said, many county parks, as well as city parks that I'll talk about in a second. And we also have very close to us, coming through Washington County, a bit of the Appalachian Trail. So a beautiful, beautiful area, and yet we have some of the same challenges in terms of our community that we heard in that Fraser neighborhood. So Meredith, just prior to the pandemic, in November of 2019, embarked on a strategic sprint exercise with our new CEO, Dr. Malik Joshi, who just happened to be a doctor of public health. It was very fortuitous for us that a doctor of public health became our new CEO just prior to the pandemic, and less than 90 days into his role here, the pandemic hit. But we started to form this strategic plan, the sprint around our opportunities for the community around the quadruple aim: health, healthcare, joy at work, and affordability. So I am privileged to lead with my team the Health Bold Goal 2030 to lose 1 million pounds in the community, putting the patient and the community right in the center. Our healthcare aim is zero patient harm. Joy at work is to be a nationally recognized employer of choice, and affordability to be the lowest cost, highest quality provider and health system in the state of Maryland. And this just shows, again, a very common slide of why invest in wellness and prevention. David Nash says, we need to turn off the faucet and quit mopping up the floor. For all of us in healthcare, it just behooves us, for all the reasons we just heard, to promote cultures of wellness and prevention for all the reasons exhibited on this slide. You see the significant percentage of impact in healthy behaviors compared to the spend on the downstream effect of all of the disease processes. Here's some data from Washington County. It shows us our breakdown by race and ethnicity. And this is a busy slide, but this is fresh off of our recently completed community health needs assessment. And guess what? It shows at the top our biggest challenges: mental health, obesity, overweight, substance use disorder, and diabetes, all within sort of percentage points, really at the top problems in the county. And that has been the case here for quite some time. The pandemic did not help us at all. And as a matter of fact, when we look at the 2021 county health rankings, we actually slipped 6 places out of all the counties in Maryland. So we're really in the bottom quartile in Maryland for all health outcomes. And we don't want to be in last place. Who wants to be in last place? We have challenges, just like the Fraser neighborhood in the county. And you see by concentration of color, again, sort of the darkest area is the 21740 zip code of Hagerstown. We have 21742, which is also Hagerstown, and then the outlying rural areas of the county. And this is just showing the people living below the poverty level. And that basically then broken down by race, ethnicity, shows not a big surprise, like many communities, disproportionate numbers for those of Black or African-American descent, 2 or more races, and the Latino population, as well as some of our Asian American population. What's interesting to point out here is that the Hispanic Latin population has nearly doubled over the past 10 years, from 4% up to almost 8%. And there's been a 50% increase in those who claim 2 or more races, to up to 7.3%. Not surprisingly, we have actually shown that those folks are not getting the services and not getting to the hospital. So like many systems, we've tried to go out to highlight and bring services and partner, again, the word partnerships, in an effort that we launched called Go for Bold, Do, Eat, and Believe in a Healthy Washington County. Again, this breaks down by zip code within Washington County, the socioeconomic needs. I'm going to move through some of these quickly to talk more about our Go for Bold in just a moment. Obesity just remains one of our most difficult problems here. And it's a difficult problem, not as a surprise to the audience today, across our nation. But really, Maryland is among the most obese states in the nation. And then Washington County, as I mentioned, is one of the most obese counties in the state of Maryland, which has 24 counties. Food insecurity was touched on a little bit, and it follows, not surprisingly, the same demographic split up. And of course, diabetes, for many of the same reasons. So we got a group of stakeholders together in Washington County, and we started to look at equality and equity even before the pandemic. And what was interesting about leading this Health Bowl goal is just prior to the pandemic, in January of 2020, we brought about 40 partners together with the Meritus senior team, board members, community members, organizational heads, industry heads, and government officials. And we said, okay, if these are the big problems that we've known have existed in our community, what out of all of these challenges, what would be that one big moonshot goal by 2030 that we could do that would significantly impact the community? And we could have picked opioids and substance use disorder and mental health. But if you remember back to that original slide, they all were so close to the top and continue to be so, that the community really rallied around the idea of obesity. And we studied the Oklahoma City model. In 2007, Oklahoma City was named one of the most unhealthy cities in the United States. And in 5 years, with about 40% of engagement of their population in the city of 250,000 people, they knocked it out of the park and lost 1 million community pounds together. A little bit more about that later. But we have about 150,000 individuals who live in Washington County, and then about that same amount in the region around us. And we thought, if they could do that there, why not go for our moonshot here and do that? And then this is just one of my favorite slides to talk about equality and equity, just illustrated by sort of the bicycle or mode of transportation, where everybody gets a mode of transportation under equality, but equity is getting the appropriate vehicle, that is suited and situated to their special needs. And I think this is where partnering and parks and recreation really play a part. We did a health equity report here at Meritus, again, a sort of busy slide, but this is looking at our own health disparities at Meritus. And you can see that they were around sepsis, core measure, preterm birth rates, newborns exclusively being breastfed, opioids administered in the emergency department, meaning pain addressed in an appropriate manner, poorly controlled diabetes, and emergency department throughput time. And you can see where we had disparities less than 10% and disparities greater than 10%. And so again, this is data that we were able to do and work on here. We created a weight tracker app. This is not the most current shot. I'm really happy to say that out of the total registered users today, we just crossed the 3,000 threshold. We're on our way to try to get to 4,000 or above by June 30th. And our total weight now is almost 33,000 pounds lost just in the year and a half since this was launched. This campaign was launched somewhat delayed because of the pandemic. Even though we had that meeting in January of 2020, We actually had to delay the April launch to October of 2020. And we've had to do it, during the pandemic in various ways and scale back some of our community celebrations and some of our promotional events. So as we sort of come out of this or enter this new phase of management of the pandemic, there's more and more gathering excitement that is going to get us, I think, closer to and hopefully exceed our goal by June 30th. As we ramp up these goals, we didn't just break it down to lose 100,000 pounds, every year for a 10-year campaign. We ramped it up. So next year we hope to actually exceed 75,000 pounds. And we actually hope to get closer to over 7,500, maybe even as a stretch goal over 10,000 registered users. This just shows how we can drill down on our data atlas, sort of the metrics of what our community partners and individuals are doing, how much we've led as the largest employer as Meritus Health with close to 3,000 employees, and then with our community partners. And we'll talk more about that in just a moment. So as I said, we launched Go for Bold, Do, Eat, and Believe in Healthy Washington County. And this is where you would go to Healthy Washington County's website, www.healthywashingtoncounty.com. And it is a partnership between Meritus Health and the County Health Department, our local health improvement coalition. And Healthy Washington County has existed for several years with lots of people doing really good things. But this was really a unifying campaign around the common goal to say, what can we all do together to get to be a healthier community? You sign up, you register for the weight tracker. It does not release any personal health information. It's an accountability tool that simply accounts for the cumulative pounds lost by the registrants in the community. So you know what? If you gain back a few and then you lose some more, it's only accounting for where you were at your heaviest weight and where you were as you go to your journey personally and then as a community to becoming healthier. So this is predicated, by the way, that if everybody were to be 2 to 3 pounds closer to their ideal body weight and then maintain and sustain that over the 10 years, we would easily achieve that goal. So this is what it looks like when you sign up. We showed you a little bit about year one. We wanted to get to 25 partners and we got to well over 40. We had organizations pledge, wanted to get over 250,000 pounds pledged, and this is where we were at the end of year one. We wanted to lose 10,000 pounds lost in the first year, and then we got to 11,420. Year two, we wanted to get over 50 partners. That will end June 30th. We are actually today at 54. We want to get over 4,000 registered users. Again, just updated today. We're getting a lot of momentum as we get closer to the end of the push. We are actually at 3,001 as of today. 500,000 pounds pledged, and we're actually at that point pledged by organizations, and then actually losing greater than 35,000. And as I mentioned, we're very close to 33,000 today. So we're getting close. We're putting on our final push with 44 more days to go to get to our goals. So key takeaways. Local government leadership and influence is key to generating excitement and achieving this. So we actually found out with a little bit of grant dollars, we had a one-year sort of audit by an independent organization that has done this in Vermont called Let's Lead. And they said, you know, everything looks great, you're building momentum, you've got to get your local government leaders involved. And so we took a challenge out to the city government, the mayor and the city council, and to the county commissioners and the county government. And a lot of our excitement over this work that we've done over the last month is in them really trying to incent their employees to register for this, and then to also recruit another family member or other colleague, coworker, or friend. So sort of, you know, register yourself and refer one. We've built a coalition of business and organizational partners, as I said. And you know, when health and wellness is promoted by all the stakeholders in a community, like we just saw, the status of the community rises by all indicators, social and economic. And that certainly is the case with the Oklahoma City, you know, example. So for instance, there are beautiful parks in this community, but we can't connect them by safe walking paths or bike paths or a way to cross Route 40 called the dual highway here. So lots more to come on doing this. And this is about so much more than weight. It's by do, increasing activity, eat by making healthy food choices and addressing food deserts, and by decreasing stress and anxiety, and improving mental health. And that, of course, really pulls in substance use disorder and addiction and many of the other aspects of mental health. We have normalized this as part of our annual operating plan through aims and actions and year-by-year goals that we share with the community and encourage our community partners to be a part of. So here's a sampling of our community partners. And I would say, there's a little blurb here that the slides can go out to you. You can look this up later, but we really believe that this is population health in action. And really, it's really time to stop just sort of assessing this with numbers and really putting it into action. As Arthur Ashe has said, start where you are, use what you have, and do what you can. Also included in the slide deck, I skipped over because we weren't going to play it today. There's about a 20-minute clip that you can access, but you can look it up on TED-Med or TED Talks, where the former mayor of Oklahoma City, Mick Cornett, talked about exactly what that effort did in 5 years in their community to really taking Oklahoma City, beautifying it, creating safe walking, running paths, connecting their parks, and really bringing and attracting businesses to downtown, turning it really from a commuter city into a city that people desire to live downtown. And our vision here is, beyond doing that with the city of Hagerstown, is to spread that out into the county. We absolutely hope that NRPA can be a partner, and I've already had lots of ideas to try to say, what can we do to continue to build on this excitement to be a community wellness hub. Let me stop my sharing, if I can, and then entertain questions.
Great. Well, thank you so much, Doug, and thank you, Allison. I want to remind attendees, if you have any questions, please go ahead and put them in the chat. But before we get to any of those or any of my questions, I just want to comment on how exciting it is to see the efforts that Doug talked about at the community level and all the different partners you have to get together, and then to hear from Allison about how parks and recreation facilities are so aligned with what we're trying to do in healthcare and doing so many different services. I think my first question to Allison might be, I love that you are trying to raise all the boats, right, with your initiatives and your frameworks. But I would imagine if you've seen one park and recreation facility, you've seen one park and recreation facility. So where, and they may be differing different services or have different capabilities, where might a doctor or a resident or somebody who just goes out and practice somewhere new, where might they start to figure out how to connect?
Yeah, that's a great question, Scott, and thanks for it. I will say that park and recreation systems vary drastically across the country. And so they all do really sort of have their own, operations, very different facilities, very different responsibilities in terms of programming and services. Some departments are really primarily focused on maintenance of green space, whereas others are serving in more of these community service provider or social service provider roles. So it really differs. And NRPA, we represent these agencies, but we don't have, any authority or jurisdiction over them. They're all typically funded by taxpayer dollars and report to city council or the mayor, the local governing body. So my best advice is to try to contact your local park and recreation agency directly. We can help support that and make connections where we have inroads. But typically they are very, very excited and open to partnerships, especially with healthcare providers. The pandemic has really just sort of served as a catalyst for recognizing, the role of Parks and Rec in promoting public health, but also the need for those relationships to be in place with, physicians and healthcare systems across the community. So best advice is to check out the website, do some outreach, pick up the phone, call people, but certainly can reach out to NRPA as well.
Great. The other element of both of your presentations that I think is really critical is the importance of shared data. and figuring out, how do we track these patients and community members as they go from one service to another, and how can we work together to show the impact. And so I wonder if either of you, Doug or Allison, have any thoughts about how that works and how that may have come together. Doug, in Hagerstown, in your area, I imagine it's kind of a challenge.
Well, yeah, like it's a challenge in many health systems. I would say that we had the blessing of getting on a unified electronic health record in our health system in September of 2018. So that was great. We have an incredible team. It's not a huge team for a 300-bed community hospital, but it's a team that's really dedicated. They built the weight tracker in a secure way that could be shared on the county website that we don't own at Meritus. So it truly is an example of partnering, and has a secure URL that allows people to register and would keep track of us as Meritus employees, but also all of those other partners, or even just individuals that sign up. And then I would say that we have the CRISP, the Chesapeake Regional Health Information Exchange, and that has been a good source of data as well. But, data is what, you have to sort of question it. We, I think many times as physicians, are skeptical of it. So owning the data, having transparent data, sharing it with not just our own physicians and teams here inside the walls, but with the community, has really created a lot of trust. And that, of course, came together and was magnified, I would say, even in more meaningful ways when we had to pivot quickly and take care of the community together through the health department, through Meritus during the COVID pandemic.
I would just quickly add to that, and Doug, definitely data sharing has been one of the biggest challenges our agencies have expressed in terms of partnerships with healthcare providers. But I would think of your park and recreation partners as an avenue for collecting more of that qualitative on the ground community level data. So oftentimes they are, having community events, or even some with the impact of sort of the racial justice movement that's been taking communities really by stride. We're seeing community conversations being held about these very real inequities and challenges that exist. And so looking at partnering with Parks and Recreation around how can you get a seat at that table to just be able to listen to community members' very real concerns around the social determinants of health and access to healthcare would be really powerful.
I will just piggyback onto that. Perfect example is that the Deputy Director of Parks and Recreation for the City of Hagerstown sits on our Community Steering Committee. And the way that these partnerships come together, we have somebody who leads a group called Primetime for Women, who hosted with one of our physicians here at Meritus Walking to Wellness Wednesdays, which just started the beginning of May and goes all the way through September, to take advantage of this beautiful weather we're having. And one of those metrics is it's growing week by week, the number of attendees, and they're coming to a beautiful park in a pretty tough neighborhood that some people have never been to before, but because they did it in the community, it's opening people's eyes to the beauty here and what the vision could be as we transform, as we do transformational change for our community. So that's a really exciting example of what you just said.
Great. I think we're just about at the half-hour point of the hour, so I want to make sure we end on time. But thank you so much. I think there's so much potential for partnerships between park and recreation facilities and health systems and hospitals, and we've heard a lot from what the national level is doing, and then some examples on the ground. So I hope people are inspired and that they want to reach out to their local parks and reach out to FMEC and the NRPA to find out what else they can do. So thank you again to Allison and Doug for being our presenters today. Watch for an evaluation, and also watch for the recording and the slide sets from this webinar to be posted. And with that, everyone, have a wonderful evening.
Thanks so much.
Thank you. Bye.